It may come as a surprise that certain fruits have the potential to accelerate the aging process, impact cognitive function, and elevate blood sugar levels more significantly than a can of soda. Certainly, please provide the recent study published in the Journal of Clinical Nutrition that you would like me to translate. Individuals aged 65 and older who frequently consumed specific high-sugar fruits exhibited a significant 57% increased risk of developing metabolic syndrome, a serious condition associated with strokes, diabetes, and heart failure. The most concerning aspect: these fruits are frequently recognized for their health benefits and nutritional value. Certainly, please proceed to provide the text you wish to have translated. It is important to note that individuals over the age of 65 may experience diminished digestive function, and while fruits are generally considered healthy, certain varieties may pose risks to this demographic. The metabolic rate may decrease, cellular vulnerability can increase, and there may be heightened difficulty in managing sugar levels. Selecting inappropriate fruit can lead to adverse effects rapidly. There is positive information to consider. Certain fruits have the potential to contribute to lower blood pressure, enhance cardiovascular health, and provide cognitive benefits. Certainly, please share the text you would like translated. Do you feel significantly younger than your chronological age? In this video, we will discuss 4 essential fruits that seniors should incorporate into their daily nutrition, as well as 4 that should be avoided. Pay special attention to the last item on our caution list. It is quite palatable, refreshing, and popular among many, yet it may be depleting your energy and potentially impacting your longevity. Before we proceed, we invite you to engage with us. Please leave a comment indicating your location and remember to click the like button. We encourage you to subscribe to our channel for additional informative content. Let us proceed directly to our 4th item, which is avocados. Interestingly, they are classified as a fruit and warrant significant attention. Contrary to previous recommendations to eliminate all fats from the diet, avocados represent one of the most beneficial food options for older adults to incorporate into their meals. Notably, avocados are rich in healthy monounsaturated fats, particularly oleic acid. Avocados are highly beneficial. These interventions can effectively reduce low-density lipoprotein, LDL cholesterol levels, while simultaneously increasing high-density lipoprotein, HDL cholesterol levels. This is beneficial for the elderly population with cardiovascular concerns, as improved cholesterol levels are associated with a reduced risk of myocardial infarctions and cerebrovascular accidents. Additionally, it is important to note that avocados contain a significant amount of potassium, approximately 975 mg per fruit. Bananas represent a beneficial option for the management of blood pressure levels, particularly considering that approximately 23% of individuals aged 65 and older are affected by hypertension. Avocados contain a significant amount of potassium, which plays a crucial role in balancing sodium levels and promoting the relaxation of blood vessels. This natural method may assist in reducing your blood pressure without the need for additional medication. Additionally, avocados contain a significant amount of lutein, an antioxidant that is beneficial for ocular health. Mitigating the progression of age-related macular degeneration, a significant factor contributing to vision loss in the elderly population, is of paramount importance. One significant benefit of avocados that is frequently underestimated is their ability to enhance nutrient absorption in the body. Numerous vitamins and antioxidants found in vegetables, such as vitamins D, E, and K, require the presence of fat for optimal absorption. Incorporating an avocado into your salad or cooked greens can enhance the absorption of vital nutrients by approximately 15%. To optimize your nutritional intake without the dependence on numerous supplements, consider incorporating half an avocado into your daily diet. One may find it quite remarkable how beneficial it can be for overall health. This can be applied to whole grain toast, incorporated into a smoothie, or consumed directly with a splash of lemon juice. This fruit is highly beneficial for the health of seniors, regardless of how it is consumed. It is important to acknowledge the nutritional benefits of apples. They possess a satisfying crunch, are fresh, and offer a delightful flavor profile. Apples are highly beneficial. These foods are rich in fiber, particularly a type known as pectin, which is beneficial for promoting the health of beneficial gut bacteria. Maintaining a healthy gut is essential for optimal digestion, enhancing immune function, and improving nutrient absorption, all of which become increasingly important as we age. Interestingly, apples have been shown to have beneficial effects on cardiovascular health. The pectin present in these substances aids in binding cholesterol during the digestive process, facilitating its elimination and contributing to a reduction in low-density lipoprotein cholesterol levels over time. Additionally, they are rich in flavonoids. Apples are beneficial in combating inflammation and enhancing cardiovascular health. Additionally, they are essential in maintaining stable blood glucose levels. Although they possess a sweet flavor profile, they exhibit a low glycemic load, and their fiber content contributes to the gradual absorption of sugar. This characteristic is beneficial for mitigating fluctuations in blood glucose levels. This information is particularly beneficial for older individuals who are dealing with insulin resistance or type 2 diabetes. Additionally, apples are highly satiating due to their significant fiber content. Apples are effective in managing hunger due to their high water content. Chewing apples has been shown to stimulate saliva production, which may contribute to a reduced risk of cavities and gum disease, conditions that often become more prevalent with age. Apples, regardless of their color, red, green, or yellow, are highly convenient and versatile fruits, offering a range of nutritional benefits. Incorporating one additional element into your daily regimen can positively impact nearly every major physiological system within the body. Pomegranate, while perhaps less renowned, possesses its own set of beneficial attributes. Certainly, please share the text you would like me to translate. When considering a rapid snack option, pomegranates are likely to be among the first choices that arise. For older adults, this vibrant ruby red fruit serves as a valuable asset for cardiovascular health. With advancing age, there is a tendency for arterial stiffness to develop, potentially resulting in diminished blood flow, elevated blood pressure, and increased workload on the cardiac system. Pomegranates are noteworthy due to their high content of punicalagins, a potent antioxidant that has been shown in studies to significantly reduce oxidative stress in the arteries by more than 30%. Research on atherosclerosis indicates that punicalins may exhibit antioxidant effects that are potentially 3 times more potent than those found in red wine or green tea. The accumulation of oxidative stress can lead to inflammation and result in the narrowing of arterial walls, similar to the way rust accumulates within an aging water pipe. However, punic allergens contribute to enhancing blood circulation, facilitating a more efficient and streamlined flow. Additionally, research indicates that the consumption of pomegranate juice may result in a reduction of systolic blood pressure ranging from 5 to 21%. Individuals diagnosed with hypertension may consider incorporating pomegranates into their diet as a beneficial option for older adults seeking to manage their blood pressure levels without the need for additional medication. However, that is not the information I would like you to translate. Pomegranates may also contribute to enhancing memory and cognitive function. Research conducted by UCLA indicated that older adults who consumed pomegranate juice daily exhibited significantly improved performance on verbal memory assessments in comparison to those who did not partake in this dietary habit. This matter holds significant importance as cognitive decline is among the primary concerns associated with aging. Pomegranate juice is beneficial for dental health, and it does not require chewing for consumption. The concentrated antioxidants present in the text require translation. Supplements have demonstrated positive outcomes in various studies. Consuming whole fruits provides additional dietary fiber along with essential vitamins. It is not necessary to consume an entire glass on a daily basis. Incorporating half a cup of the seeds or a small amount of the juice into your morning smoothie can provide significant benefits. Pomegranate is a superior choice compared to many sugary alternatives. Fruits that possess a low glycemic index are advantageous as they do not induce significant fluctuations in blood glucose levels. This renders them an ideal option for elderly individuals managing prediabetes or type 2 diabetes. It is essential to select pomegranate juice that is 100% pure and free from any added sugars. It is essential to consult with your healthcare provider if you are taking anticoagulant medications, as pomegranate may have potential interactions with certain pharmaceuticals. Additionally, this fruit not only enhances your overall health, but may also contribute to a more youthful appearance over time. Take your time to explore the nutritious world of berries. Blueberries, raspberries, and blackberries are available to enhance your dietary experience. These fruits are highly recommended for older adults due to their significant health benefits. They are particularly advantageous for brain health and cognitive function, making them an excellent option for individuals aiming to maintain mental acuity. Certainly, anthocyanins are naturally occurring compounds found in various plants, including blueberries, which contribute to their distinctive coloration. Additionally, these compounds serve as potent antioxidants, providing various health benefits. The consumption of berries activates potent compounds that contribute to the reduction of inflammation within the brain and enhance intercellular communication among neurons. Recent findings published in the Annals of Neurology indicate that older adults who consume 2 servings of blueberries weekly may experience a deceleration in cognitive aging by approximately 2.5 years. Over the years, it has been observed that they significantly contributed to enhancing the cognitive abilities of an individual who is 2.5 years younger. The neuroprotective advantages appear to stem from berries' remarkable ability to traverse the blood-brain barrier and mitigate damage within brain tissue. The benefits extend beyond cognitive function. Blueberries also contribute to improved balance and coordination, which are critical factors in fall prevention, a significant cause of injuries among the elderly population. Regular consumption of berries is highly beneficial for overall health. Incorporating berries into your daily diet may provide significant advantages for cardiovascular health. Numerous studies indicate that older adults who incorporate berries into their diets frequently experience significant reductions in blood pressure, enhanced vascular flexibility, and decreased levels of inflammation. This intervention can markedly decrease the likelihood of developing heart disease, a critical consideration given that heart disease continues to be the leading cause of mortality in the older adult population. Additionally, berries are beneficial for maintaining stable blood glucose levels due to their fiber content and other health-promoting components. Certain compounds assist in maintaining stable blood glucose levels postprandially, which is particularly beneficial in mitigating the acute elevations that may exacerbate diabetes or prediabetes, especially among the elderly population. Berries are an excellent dietary option, as each cup contains approximately 8 grams of fiber. This characteristic contributes positively to gastrointestinal health and promotes regular bowel movements, while also being well tolerated by individuals with sensitive digestive systems. Incorporating a serving of berries into your daily oatmeal, yogurt, or smoothie can significantly enhance your energy levels, improve cognitive function, and elevate your mood. It is advisable to select fresh or frozen blueberries to optimize health benefits. It is recommended to avoid dried blueberries, as they often contain added sugars that may diminish their nutritional advantages. Following an examination of the four fruits that are highly beneficial for seniors, it is important to consider four fruits that may be best avoided. Commencing with an item that may already be present in your kitchen, the fourth item on the list is grapes. Upon initial observation, grapes present themselves as a palatable and nutritious option for snacking. These delightful morsels are not only sweet and refreshing, they are also rich in antioxidants, particularly those found in red and black varieties. However, for the elderly population, the consumption of grapes may present certain difficulties. The primary concern is elevated glucose levels, coupled with insufficient dietary fiber intake. Grapes contain significant amounts of natural sugars, including glucose and fructose, which can lead to excessive consumption when eaten in large quantities. This may inadvertently result in excessive consumption. It may be surprising to learn that a single cup of grapes contains approximately 23 grams of sugar, which is comparable to the sugar content found in a small candy bar. For elderly individuals managing their blood glucose levels, this can be a significant concern. Insufficient fiber intake can lead to a rapid increase in blood sugar levels, resulting in a swift elevation of insulin levels in the bloodstream. The spikes in question are not merely transient occurrences, they can persist and contribute to weight gain and inflammation. While grapes may appear innocuous, they do possess certain drawbacks. The consumption of these products is associated with an increased risk of developing type 2 diabetes, and in the absence of organic certification, they may contain pesticide residues. This may pose a concern for the elderly population, particularly those with compromised immune systems or heightened gastrointestinal sensitivity, as they are more susceptible to the effects of toxins. Additionally, although the skin is palatable, it does not provide significant nutritional value when compared to the skins of other fruits, such as apples or pears. Please consider that information carefully. Elevated blood glucose levels can pose significant challenges for older adults aiming to maintain their energy levels, weight, and overall health. Dried fruits, often perceived as a nutritious and convenient snack option, rank third on the list of concerns. Despite their appealing appearance, particularly those treated with sulfites during processing, they can present issues for seniors. The primary concern is that dried fruits contain a high concentration of sugar. The drying process effectively concentrates the sugars present, resulting in a product that may not align with dietary recommendations for this population. A small quantity of dried apricots contains approximately the same level of sugar as a comparable amount of fresh apricots, which can lead to an unintentional increase in sugar consumption. Additionally, due to the absence of fiber and moisture found in fresh fruit, dried fruit may not provide the same satiety. Elevated blood sugar levels can pose a considerable risk for older individuals diagnosed with diabetes or experiencing insulin resistance, as even minimal increases can lead to substantial fluctuations in blood glucose levels. Over time, this may result in the development of type 2 diabetes or exacerbate existing conditions. Managing diabetes involves more than merely monitoring glucose levels. Fluctuations in blood sugar can lead to a variety of additional complications. Their potential to exacerbate inflammation may intensify arthritis-related discomfort, accelerate cognitive decline, and possibly compromise immune function, an aspect that is particularly concerning for the elderly population. Additionally, many commercially available dried fruits contain added preservatives known as sulfites, which are utilized to maintain their appearance and prolong freshness. In certain individuals, sulfites have the potential to trigger significant asthma attacks. It is imperative for the elderly population to be vigilant regarding this matter, as the aging process significantly impacts pulmonary function. Older adults exhibit a higher susceptibility to asthma and chronic obstructive pulmonary disease, COPD, thereby elevating their associated health risks. Approximately 1 in 100 individuals exhibit sensitivity to sulfites, with this prevalence increasing among older adults who have respiratory conditions. Additionally, the sugars and preservatives present in dried fruits may pose challenges for older adults with inflammatory conditions such as arthritis, a condition affecting nearly half of the adult population. While green bananas may be considered a nutritious option for certain older individuals, it is important to note that unripe bananas can pose potential health risks. Their ranking is relatively low when considering the optimal fruits for the elderly population. The primary concern regarding green bananas is their high content of resistant starch. In contrast to the sugars found in ripe bananas, which are readily digestible, this resistant starch remains undigested in the small intestine. This characteristic may pose challenges for older adults who often experience digestive issues as they age. Insufficient production of digestive enzymes, coupled with decreased gastrointestinal motility, can result in the fermentation of resistant starch, which may lead to symptoms such as bloating, gas, and abdominal discomfort. Older adults experiencing irritable bowel syndrome or other inflammatory bowel conditions often face increased challenges, as these issues tend to exacerbate with advancing age. Consuming unripe bananas may lead to discomfort and can adversely affect the body's ability to absorb nutrients from other foods, which is a significant concern for overall health. Older individuals may encounter challenges in obtaining adequate nutrients due to factors such as medication effects, diminished appetite, or age-related alterations in nutrient absorption. In this context, unripe bananas may pose additional difficulties. The presence of astringent compounds contributes to a chalky texture, and in individuals with sensitivity, they may lead to gastrointestinal discomfort, potentially resulting in gut inflammation. Furthermore, in the context of nutrition, unripe bananas exhibit a reduced level of antioxidant benefits compared to their ripe counterparts. The health benefits of fruits increase as they ripen, which is particularly advantageous for older adults seeking to leverage their anti-inflammatory properties. Unripe bananas may be less palatable due to their lower antioxidant content. Let us now discuss grapefruit. It may come as a surprise that this particular fruit is one that older adults should avoid. Although grapefruit is often praised for its health benefits and its role in weight management, it poses significant risks, potentially severe or life-threatening, for elderly individuals who are taking certain medications. Medications such as phenytoin can present challenges, as they inhibit an enzyme in the intestines known as CYP384. This enzyme plays a vital role in the metabolism of approximately 85 distinct medications. Should a blockage occur, it may result in elevated medication levels in the bloodstream, potentially reaching hazardous concentrations, akin to having ingested a significantly larger dose than prescribed, despite having taken the appropriate amount. This may elevate the likelihood of adverse effects, some of which could be severe or potentially life-threatening. This list contains various medications that are commonly prescribed to the elderly population. The medication regimen encompasses widely recognized statins utilized for cholesterol reduction, including atorvastatin, lovastatin, and simvastatin. The medication list includes specific antihypertensives, particularly calcium channel blockers such as nifedipine, anxiolytics like buspirone, antiarrhythmic agents such as amiodarone, as well as certain antihistamines and immunosuppressive medications. It is important to note that the consumption of grapefruit while on these medications may result in adverse effects. Certainly, please share the text you wish to have translated. The statin lipophore has the potential to increase the concentration of the drug in your bloodstream by more than 400%, significantly elevating the risk of severe adverse effects, including muscle damage and renal failure. It is important to note that these interactions can occur even with minimal consumption of grapefruit. For instance, just half of a fruit or a small glass of juice may provoke adverse reactions. Furthermore, the effects of such interactions can persist for up to 72 hours following ingestion. Merely distributing your medication over time will not suffice. It is advisable to refrain from consuming grapefruit if you are taking specific medications, as it may affect the efficacy of those medications. It is advisable to exercise caution or consider avoidance regarding this particular fruit. It is essential to consult with your healthcare provider or pharmacist prior to consuming grapefruit or its juice while on prescription medications. It is important to avoid assuming that everything will be satisfactory, as there is a potential for significant interactions with your medications that could pose serious risks. It is important to be mindful of how specific foods may impact your health. What appears to be benign, such as fruit, could potentially lead to adverse effects. This is a concise guide for seniors regarding beneficial fruits and those that may be less advisable for consumption. Incorporating nutrient-dense options such as avocados, apples, pomegranates, and berries into your diet may support healthy aging, cognitive function, and physical strength. It is advisable to exercise caution with certain foods, such as grapefruit, dried fruits, unripe bananas, and grapes, as they may lead to unforeseen complications. Excessive consumption of certain foods can significantly deplete your energy levels, disrupt glycemic control, and exacerbate inflammatory responses, which can be detrimental to overall health. It is concerning that many individuals may not recognize that seemingly innocuous items, such as a handful of grapes or a ripe banana, can contribute to adverse effects, often only becoming aware of these issues when they manifest more severely. Therefore, it is advisable to make informed dietary choices, savor your meals, and consider pairing fruits with sources of protein or healthy fats when possible. We invite your thoughts on this matter. Do you find yourself consuming more than you realize? Exercise caution when consuming certain fruits. Have you encountered any unforeseen risks that took you by surprise? Have you experienced an unexpected reaction after ingesting a particular fruit? We invite you to share your experiences in the comments below. We look forward to your insights.